The relationship between the pharmaceutical industry and the NHS is evolving, moving away from the traditional vendor-supplier relationship to a more collaborative approach that combines resources and expertise to benefit patients. Pharmaceutical company Novartis has been working with the NHS Trust in Buckinghamshire to provide a dedicated one-stop clinic to help patients who suffer from wet age-related macular degeneration, a leading cause of blindness in the UK. Nick Thatcher has more.
Sue Carey has lived with wet AMD in both her eyes for more than 8 years. It's a condition that requires regular checkups and injections, otherwise she could lose her sight.
Living with wet AMD, you lose a lot of confidence. You find your vision changes. Instead of seeing normally, anything vertical is wiggly like that or horizontal that way. Nothing is straight.
And for Sue, receiving the treatment for her condition hasn't always been that straightforward either. In the past, she's had to attend multiple appointments each month, often arranged at short notice, and then spend time waiting to get her results.
Susan Carey?
Now a new one-stop service is transforming her care. She told me she now has just the one appointment every 4 to 6 weeks that can last less than 1 hour, allowing her to get on with her life.
So instead of having a month of appointments, you come, you have the same visual acuity tests, you have the scans of the back of the eyes, you see the consultant.
And how is everything going for you?
He treats you like a human being. He discusses the scans on his computer screen and decides there and then whether you have further injection or 2 injections. Then you go and have your injection. By that time, the receptionist has printed out the letter of your next appointment.
So all this happens on the same site, on the same day. It must make a world of difference.
It does. Absolutely wonderful. Wish they'd had it years ago.
But this macular service at Amersham Hospital would not have been set up without a partnership with the pharmaceutical company Novartis. It worked with the local Buckinghamshire NHS Trust to audit patient flow under the old system, identify pain points in the clinical pathway, and part-fund the redesign. Mandeep Singh Bindra is the consultant who first came up with the proposal.
There was a lot of hesitation and scepticism because the hospital never worked with a pharmaceutical company in this way before. And as you can imagine, there's always the worry about conflicts of interest or about governance issues. But it was very clear right from the start that this was going to be a supportive joint working agreement or partnership which didn't have any commercial implications. So we weren't in any way obliged to use a particular drug or particular type of treatment. And as the project progressed and the benefit that we could see from that project, I think it made it clear that this is going to be a very positive project, and it has been.
Those using the new service say they welcome the extra face time with a consultant, something they didn't always get before. And the consultants, supported by a team of nurses and healthcare assistants, say they can now see more patients.
So in fact, I probably spent more time with each individual patient than in a standard clinic, but we increased the capacity of patients in a clinic by about 60%. And I think that is a real success, and that is something which we will try to implement in other services in our hospital and other subspecialties of ophthalmology, hopefully in the due course.
The pressure on NHS budgets and a growing, ageing population requires innovative solutions to healthcare. And Novartis is already working with trusts across the country on projects to improve patient care in dermatology, neurology, heart failure and cancer, as well as in ophthalmology, where the company has a strong heritage.
We are the second largest pharmaceutical company in the UK. And with that position, I think, comes a responsibility. It's really incumbent upon us to work in partnership with the NHS to create a healthier NHS. And that can only really be done if there are mutual objectives, so we're actually all focused on the same goals, but also that we have relationships which are based on transparency and trust. And that's something we're really trying to foster in the examples that we have here in the UK.
For Sue, this new clinic is not just maintaining her sight, but helping her to better manage her condition. And as a model of service delivery, it's opening the eyes of clinicians, commissioners and NHS managers as to what's possible through joint working.